Welcome to the final installment of the Provider Adoption of Technology series. I trust you followed the previous sessions from history to problem identification, then on to vendor's view, impacting regulatory bodies, enterprise strategy, and future focus. We'll use this time to tie together the initial problem of physician adoption concerns to several grand theme recommendations to help you push past these issues and complete the healthcare IT roadmap. Congratulations again for reaching the final lesson of the Provider Adoption Series. In Session 4, we began to discuss strategies for tying the 25 provider adoption issues to the larger enterprise strategy. In this final session, we'll crosswalk these 25 adoption issues to the 5 facets of value-based medicine with hospital administrative-based recommendations on how to transition from problems to opportunities. We'll cover adoption issues and the world of modern value-based care influences, and then we'll wrap up. Now it's time to begin the sorting process. Under governance and staffing, we've sorted the following adoption issues: lack of technical training and support, lack of computer skills, uncertainty over return on investment, lack of support from external parties, change in organizational culture. Is there one solution that can help with the transition of most of these issues? A solution that is widely popular at this time is the use of a scribe to assist the physician in entering and maintaining the record in real time. A scribe is typically an unlicensed person hired to enter information into the electronic medical record at the discretion of the physician or provider. A licensed person could be used, but you have to consider using all of your staff at the top of their license. The scribe is present during the visit and documents everything said during the course of the service. This is a low-cost, highly intuitive solution that serves to minimize cultural impact while keeping integration costs low. In the realm of finance, we sort high startup costs, high maintenance costs, and lack of incentives. High startup costs and high maintenance costs present real-world financial barriers at the systems level of an organization. Practitioners working within a hospital are more likely to adopt than those in private practice. In 2013, Kaiser Permanente wrote off a $400 million IBM-based EMR to instead spend over $4 billion implementing Epic, based almost entirely on provider preference. Medicare physicians who did not use certified EHR nor demonstrate meaningful use were said to receive penalties of 1%, 2%, and 3% through 2017 when they billed Medicare. Penalties would reach 5% in 2018 and beyond if fewer than 75% of the physicians were using EHRs at that point. Interestingly, some private practice providers would rather take the penalty based on the perception of higher patient throughput when using the tried and true paper chart. Leveraging software as a service vendors is an obvious win. Hedgers can opt for lowest cost suppliers, and influencers can leverage their man hours to offset licensing fees. Under care delivery, we have sorted workflow changes, lack of customizability, lack of usefulness, too time-consuming, reduced productivity, perceived mobility limitations, and limitations of the system. Many practitioners have concerns with critical workflow changes when transitioning from paper to an EMR, or even when sundowning an older system to adopt a new system. As mentioned previously, let's recall that in Conway's law, a system design will follow the design of the organization. Your legacy system followed that design, but transitioning to an EMR is to transition to a system designed elsewhere. Cultural fit must be addressed, and the organization might benefit from a certified change management professional. Solutions should include the following: communicate the benefits of the EMR clearly and timely to the physicians. Physicians need to understand how EMR can advance and enhance patient care, improve productivity, reduce administrative costs. They also need to be involved in the planning, selection, and implementation of the EMR system and receive adequate training and support. Also, choose an EMR system that's user-friendly, customizable, and interoperable. Physicians are likely to adopt the EMR system that fits their workflow, practice patterns, and patient population. The system should also be able to exchange data with older systems and other providers. Also support clinical decision-making with concise and context-sensitive information. Finally, reduce physician burnout and workload associated with EMR use. Physicians often complain that EMR systems are time-consuming, complex, and distracting. To address these issues, practices should delegate data entry tasks to other team members, use voice recognition or natural language processing tools, and optimize the system features and functionalities. Sorted under Health IT, we find privacy and security concerns, issues regarding implementation, system complexity, interoperability, lack of hardware and software, and interconnectivity. Most physicians using an EMR believe that storing patient information in the EMR is riskier than paper records in terms of security and confidentiality. Many feel that the only way to correct this is through additional government regulations of security standards and privacy policies that would all secure all records. In this age of ransomware attacks, many physicians are holding on to their paper record. Government support in investigating and prosecuting ransomware crimes seems to be lackluster. Implementation issues are present in any project and require appropriate oversight and clarity of vision. Utilizing a project management professional should help, but these can be expensive to the small family practice. Lack of hardware and software might actually be a financial issue, but it squarely falls on the CIO to ensure the physician has all the tools to do their job. Interconnectivity is a multifaceted issue. Many EMRs are a one-size-fits-all, and vendors do not want to share technologies with other vendors, just as practices and ministries also closely guard patient information. This proprietary nature of data lockdown helps to define the competition between adjacent hospitals utilizing the same platform but unwilling to share patient data. I feel that an entire lecture could be written on this single subject of leveraging the platform as a competitive advantage. For the sixth time, we find ourselves addressing trust. Here, trust is sorted into lack of reliability, lack of standards, legal complications, and uncertainty about the vendor. Lack of reliability leads to downtimes, botched upgrades, and frustration. Going back to paper during a downtime is very disruptive to the entire hospital, from registration to nursing, physicians, pharmacy, lab, etc. System hardening before a rollout is a critical vendor responsibility. Lack of standards is a problem more prevalent in smaller boutique markets, and it's exposed when a new type of product is unveiled. It takes time to create those standards, but it's critical that a vendor meets all of the certification requirements presented by the regulatory body. Legal complications are a very broad category as well, ranging from contracting issues between participants to data breaches or even HIPAA violations. Ensuring these elements are spelled out in the initial contract helps to shield each enterprise from litigation. Of course, each of these previous 25 issues can lead to uncertainty about the vendor. Selecting a market-dominant system or positioning yourself as a system influencer are the best ways to drive trust in products and outcomes. This slide will be included as a bonus for staying with us this long. Marketplace recommendations will encapsulate recommendations for various players throughout the marketplace. For instance, if you're a provider organization, take it up a notch and lobby the government to ensure regulations are consumer-friendly and outcomes-driven. The government does listen. If you are a payer, ensure that your internal processes are technologically agnostic to ensure meaningful data ingest from various providers. You should improve your outcomes by using population health initiatives. As a vendor, always leverage the newest technologies to ensure competitive advantage, but also ensure that your legacy installs are well supported. A consultant must stay abreast of new trends and work to stay educated in government regulations and vendor mergers. From the academic angle, ensure that the successes and mistakes of this path are well understood and documented, and then cultivate a sense of innovation and opportunity moving forward. And now we've made it to the part of the deck where we'll start to wrap this up. Let's take a few minutes to summarize the major points covered throughout all of these sessions, and perhaps we'll whet your appetite for additional sessions in the future. Electronic medical records have taken over the business processes of hospitals. Electronic medical records are computerized systems to manage and organize patient medical data. The concept of the EMR was first described by Lawrence Weed in the 1960s, who also developed PROMIS, one of the earliest versions of the electronic medical record that followed the problem-oriented medical record documentation. EMRs became more feasible and more affordable in the 1990s with the advancement of computer hardware, networks, and internet, as well as the standardization of coding by the World Health Organization. In the 2000s, EMRs gained more political and public attention with the goals of improving medical care, research, and efficiency. Physician adoption is predictable using the technology adoption bell curve and the Gartner Hype model. The adoption bell curve is a model that describes how different segments of consumers adopt new technologies at different rates, from innovators and early adopters to laggards. The Gartner Hype Cycle is a graphical presentation that shows the maturity, adoption, and social application of specific technologies, as well as the expectations and realities associated with them. The Gartner Hype Cycle consists of 5 phases: innovation's trigger, peak of inflated expectation, trough of disillusionment, slope of enlightenment, and plateau of productivity. By using the adoption bell curve and Gartner Hype Cycle, healthcare providers can benchmark their adoption plans against their peers, prioritize their investments, and avoid pitfalls while identifying opportunities for innovation. Physicians have multiple reasons to avoid EMR adoption. Here are the top 5. Privacy and security concerns are number 1. Physicians may worry about confidentiality and integrity of patient data, as well as the legal and ethical implications of data breaches. Number 2, high startup costs. Physicians may face financial barriers to acquire, implement, and maintain EMRs, as well as to train staff and users. 3, workflow changes. Physicians may experience disruption and frustration in their daily routines, as an EMR system may require more time, effort, and skill than paper records. 4, system complexity. Physicians may encounter technical difficulties and usability issues with EMR systems, such as poor design, lack of interoperability, frequent errors, and low reliability. And 5, lack of incentives. Physicians may not perceive the benefits of EMR adoption outweigh the costs and risks, especially if they do not receive adequate support, feedback, or rewards from their organization or external stakeholders. The physician's lens of adoption misses other hidden opportunities. Physicians are primary users of electronic medical records, but they are not the only stakeholders who can benefit from them. Focusing only on the physician lens of EMR adoption may miss other hidden opportunities for improving healthcare quality, efficiency, and safety. Some of these opportunities are patient engagement. Electronic medical record can empower patients to access, manage, and share their own health information, as well as to participate in decision-making and self-care. 2, interprofessional collaboration. EMRs can facilitate communication and coordination among different healthcare providers, such as nurses, pharmacists, and allied health professionals. 3. Health system integrations. EMRs can enable data exchange and interoperability across different healthcare settings, such as primary care, hospitals, and long-term care. 4. Health research and innovation. EMRs can provide rich and reliable data for conducting clinical trials, epidemiological studies, quality improvement projects, and health policy analysis. Now, to continue our wrap-up, vendors are recreating the loyalty loop to shift ownership. The loyalty loop is a concept that describes how customers repeat their purchase decisions based on their satisfaction and trust in a brand. EMR vendors are recreating the loyalty loop by offering more personalized, engaging, and flexible solutions that cater to the needs and preferences of different healthcare providers and consumers. Some of the ways that EMR vendors are doing this are providing customized features and functionalities that suit the workflows and goals of different medical specialties and settings, enhancing user experience and satisfaction by improving the design, usability, reliability, and interoperability of the EMR system, empowering consumers to access, manage, and share their own health information through patient portals, mobile apps, and wearable devices. Finally, leveraging data analytics and artificial intelligence to provide insights, recommendations, and feedback to improve clinical decision-making and outcomes. By recreating the loyalty loop, EMR vendors are shifting brand ownership to the consumer, who becomes more involved, loyal, and influential in the EMR market. Vendor heuristics should complement physician strategies. So EMR vendor heuristics are rules of thumb or best practices that guide in the design, implementation, and optimization of an EMR system. Physician strategies are the goals, plans, and actions that the physicians adopt to use the system effectively and efficiently. EMR vendor heuristics should complement physician strategies because they can help 1. Align the EMR system with the physician's workflow and clinical needs. 2. Enhance the user experience and satisfaction of the physician and the patient. 3. Improve the data quality, security, and interoperability of the EMR system. New payment models could force a cultural impasse in adoption. New medical payment models such as value-based care and bundled payments aim to reward quality and efficiency of care over volume and intensity. These models require EMR systems to capture, analyze, and report clinical and financial data that demonstrate outcomes and performance. However, these models could force a cultural impasse in EMR adoption because they may conflict with the existing beliefs, values, and practices of physicians and other healthcare providers who are used to fee-for-service payments. Finally, in modern value-based care, physician adoption is everyone's problem. Physician adoption of EMR is crucial for improving the quality, efficiency, and safety of healthcare, as well as participating in new payment models that reward value over volume. However, many physicians face barriers and challenges in adopting and using EMR systems such as cost, workflow disruption, system complexity, and privacy concerns. These issues not only affect physicians, but also other healthcare providers, patients, and stakeholders who rely on this EMR data for their functionality. Congratulations! You've made it to the end of the Perspectives in Provider Adoption of Digital Technology course. Our goal was to ensure that for every 10 minutes spent in the inaugural series, you'd gain from years of healthcare informatics market experience. We've covered multiple nuances of the subject, including historical perspectives, consumer marketing, program ownership, strategy, etc., etc. These sessions have been mainly relevant to electronic medical records, but we've shown that the problems with physician adoption of new technologies is a much broader subject, and positive outcomes are influenced by much more than provider complaints and frustrated expectations. Your call to action is to write me and KJ Young at healthcarerepairllc.com, and let's address your specific pain points. There is a solution, and you can be the hero. Until the next sessions, remember to always heal the process. Session adjourned.